Today we're discussing one of the most critical yet sometimes overlooked aspects of patient care. Medical documentation, yay! Whether you are a seasoned professional or new to the field, the importance of accurate, timely documentation cannot be overstated. So let's dive in and talk about it. So what is medical documentation? Medical documentation refers to the written or electronic record of a patient's medical history, treatment, and care. It includes progress notes, test results, medication records, and communication between healthcare professionals. It is the backbone of safe and effective healthcare delivery. So, why is medical documentation important? It serves several critical purposes. Continuity of care. It ensures that everyone involved in a patient's care, whether it's the nurse on the next shift or a specialist, is on the same page. Can you imagine managing a patient without knowing their allergies or recent interventions? It's not just inconvenient, because it is inconvenient, but it is dangerous. Legal protection. In the unfortunate event of a dispute or malpractice claim, your documentation serves as evidence of the care provided. In court, the saying goes, if it's not documented, it didn't happen. Billing and reimbursement. Accurate documentation is essential for proper billing and coding. It ensures healthcare providers are reimbursed correctly and helps avoid costly audits. Quality improvement. By analyzing documentation, healthcare organizations identify patterns, track outcomes, and improve protocols. So, for example, noticing trends in patient infections, like viral infections, can lead to new prevention measures. And research and education. Patient records are invaluable for clinical research and training. Future generations of healthcare providers learn from the data that we record today, and that's important. Characteristics of good documentation. Now, what makes documentation good? Well, it must be accurate. You want to capture those facts. You want to avoid assumptions or opinions unless labeled as such. Timely. Document as soon as possible after the event to ensure accuracy. Complete. Include all relevant details, symptoms, interventions, and outcomes. Clear and concise. Use professional language and avoid unnecessary jargon. Legible. For handwritten records, ensure clarity. And yes, there are still handwritten records out there. You know who you are. Unfortunately, there are still handwritten records, so ensure that clarity. For electronic records, you're going to double check those entries for typos. Some common documentation pitfalls. Omissions. Forgetting to document critical details can lead to misunderstandings and errors. If you didn't write it down, it didn't happen. Subjectivity. Stick to objective facts. Like, for example, patient reports pain 7 out of 10. You don't want to write, patient is being dramatic, because they're going to ask, what is dramatic? How do you define dramatic? So stick to those facts. Late entries. Backdating or late entries raise questions about the credibility of a record. And overuse of templates. Templates are immensely helpful, but they shouldn't replace individualized notes if needed. Tools and strategies for effective documentation. You want to use structured formats. Tools like SBAR and SOAP notes guide you to include all those essential details. You can leverage technology. Electronic health records, or EHRs, they do reduce errors, they improve legibility, and offer prompts for completeness. Continued education. Stay updated on best practices and legal requirements. And double check your work. Review those entries for accuracy before you finalize them. So, in summary, Documentation is more than just a task. It is a vital part of patient care. And done well, it ensures safety, facilitates communication, and contributes to the overall quality of healthcare.